our learning for this module, we talk about the sequence of the early events of conception. So you have, I mean, look at those pictures. How can that turn into a human? It blows my mind. It's like I understand the words conceptually. It is miraculous to me. So there it shows, very tiny. You have this small uterine, little thing. It's rounded with the edges. You go into this yolk sac, and then they change the terminology to embryo. It's an amnion, and from there it becomes a fetus. And so the question becomes in this time, what's going on, and what can go wrong, what can go right, and what's impacting that development. On Tuesday, you are going to watch Conception to Birth and Miracle in Life, and they're going to really go into detail about what happens in these 40 weeks. So we're not going to really talk about what is happening as much as what is impacting what's happening. All right, so teratogens. Teras is Greek for malformation, and a teratogen is any environmental agent, an environmental thing. Agent is a fancy word for a thing that causes damage to the fetus during the prenatal period. There's 4 factors that I want you to understand. And when you first hear the word dose, what do we all think of? When you hear the word dose, you think of what else? I think of medicine, right? Pills. Yeah. Okay. Well, dose isn't just that. Dose here is referring to how much. So how much of this teratogen, because there's more than just medicine, pills. It's more than just that can happen. So dose is how much. We talked about hereditary, right? We talked about genes. So is there a genetic factor, and how strong is it? Is it both family? Are both parents bringing that in? Is it just one? Is it a dominant gene, recessive gene? Are there other negative influences happening? And we're going to talk about what some of those might be later. So we're going to leave it very generic right now. But are there other negative things happening? And then the age of the mother. Biologically, early 20s, a woman's body is prime for making a baby, for feeding that life. But there's a lot of other factors like that come into, are you ready to be a parent? And our society has changed, but biologically you're very ready in your 20s. So as you get older into your 30s and 40s and even 50s, there can be some risks that come along with age. I will say that with modern medicine, those risks have been reduced quite a bit. So you've got this impact of modern medicine coming in too. So 4 things. Dose, how much of the problem of the teratogen is happening. Hereditary. Is it coming from both? Is it recessive? Is it dominant? Lots of different potentials for other negative influences. And the age of the mother. Not the father, but just the mother here. And that's where and let me clarify that that's the mother that is housing the fetus, if you will. Because also with modern medicine, you could have the maternal age of the ovary is different than what it's being housed of. We have a story of that in Allen County. It's a beautiful story of a mom and dad where the mother has a genetic disorder where her body essentially starts attacking the fetus, and it almost killed her and her firstborn son. It was horrible. And so they were able to have children by having a surrogate mom. But in that case, then you have 2 maternal ages that are impacting development. Okay. The textbook has a great chart that helps us understand that there are different critical periods. So big picture here, you do not need all this information. I want you to be aware of the information, okay? So look at the chart. You'll see in those first 2 weeks, when something goes wrong, it just dies. And most women, it's actually really interesting. I need to look at the statistic, but a lot of women have a miscarriage. They have no idea they were ever even pregnant. And that's because for some reason in this first 2 weeks, sometimes up to 6 weeks, something just spontaneously goes wrong. And then the woman just has her period and she doesn't even realize it was a miscarriage. But there was actually conception and then just something didn't go right. And so she miscarriages. It's a very natural process. And so it's called prenatal death. All right. Major structural abnormalities. You see that at the bottom of the chart? That's where from week 3 to 8, already in those first weeks, we know that that's where some major things can go wrong with your heart, your arms, your limbs, your eyes, ears, teeth. You see that? The whole brain. Again, remember, we check ultrasounds. That's the one prenatal test that we do on all children, all babies. And we typically only do it twice. Sometimes it'll be done more often. And it's checking for the size of the brain. They check for the major organs. They check to see that the limbs are all coming. And so they'll check for those beginnings to make sure things are going right. And then there's what they call physiological defects or minor structural issues that can happen, and those tend to happen in the later weeks. So just different critical periods are what we call those. And that comes from your textbook. So obviously, one teratogen that I want you to list are drugs, legal and illegal. It's important. In the past, there have been some different issues that were realized. One is thalidomide. Do you remember this, Mrs. Henke? Did you ever know anybody that had issues with that? It was a drug from the 60s and 70s, and it caused major birth defects, and they didn't understand it at the time or know what it was. Same for the other one, DES. Again, it was a legal prescription drug that women would take for different things, and it caused major birth defects. And this is explained in the second bullet point. So currently, the most potent is a vitamin A that's given for acne, and so it tends to be something that's only given to teenagers or people in their 20s when they're most likely to be having acne problems. And this is a good example of a drug that often a doctor prescribing the drug will also make you take birth control at the same time. And that's because it's known for doing such horrific things to a developing fetus. And the reason is in italics there at that bottom slide. In any drug with a molecule small enough to penetrate the placenta barrier can enter the embryonic or fetal bloodstream. So that's kind of the key there, is if there's a molecule that's small enough, if that drug is composed of a molecule that's small enough that can enter the placenta, then it's often heavily regulated as far as if that could be damaging. Illegal drugs, we know in the US as of 2016, so that's kind of an old statistic at this point, nearly 6% of US women were known to take an addictive drug or mood-altering drug. Those can include antidepressants or psychological drugs. If you were bipolar or had schizophrenia, those would all qualify. Just like legal prescription drugs, illegal drugs, all of these can have effects of the fetus: prematurity, low birth rate, brain abnormalities, physical defects, breathing difficulties, and even increased death around the time of birth. Because remember that chart. If we go back to that chart, those critical periods, right? I know that that Teratogen box is not big enough, so you might flip your paper over, add on notebook paper, whatever you guys think is good for you, okay? It's not just fill in the box and you're done, always. Sometimes it is. Not this one. So what happens when a baby is born with addiction? It's really quite terrifying. The baby would likely show signs of fever. It would be irritable. It would have trouble sleeping. It would have shrill cries. Everything that you would see in a movie when you see someone going through withdrawal, that's basically what you're going to be seeing the baby going through. Evidence shows that drugs introduced in the womb can cause constricted blood vessels, impacting oxygen delivered to the fetus. Okay, so think about this, like just conceptualize what's happening. The reason the drug is bad is not the drug itself. It's the fact that that drug is constricting the blood vessels, decreasing the flow to the developing brain that controls your whole body. It alters the production of neurons and the chemical balance in the fetus's brain. And so then think about all these effects that are listed there. Perceptual, that means your vision and your hearing. Motor, attention, memory, language, impulse control, into adolescence. We even know marijuana can do a lot of these same things. Alcohol, we're going to talk about later, it can do these same things. There's a reoccurring theme with all of these. Now, the lasting consequences, it is a fact, they are not well known. And I want to pull to Brofenbrenner, the ecological systems guy, all your communities impact you, because some of this is really daunting and scary. But the key is as it gets, as a person has more time in the rest of the world, they have more life of, more living that they do. There's also that opportunity for more supports to help them overcome some of these physiological challenges that may have happened because of negative things when they were during prenatal development. So it's really negative and daunting and scary, but yet there's this chance for us to do so many things right. I'm going to keep going, but this is out there, okay, for you. All right, so your key takeaway. I didn't change this here. Don't look at my thing. I didn't change my key takeaway. My text isn't right on the video. So, but the key takeaway here is what I just said, is that lots of things can go wrong. And it's all back to that neurological development is really where the drugs are impacting that child and what those effects have on the child. But then you throw in this element of environment influence, and there can be a lot of positive that happens. Okay, tobacco. So another teratogen. So we talked about drugs. Now we're going to talk about tobacco. So 10% of women will smoke when they're pregnant. I've had students go through my class and then turn around and I've seen them smoking when they're pregnant. We had a heart-to-heart. But it happens because it's an addiction. So effects: low birth weight, increased likelihood for miscarriage, prematurity, cleft lip and palate. Do you guys know what that is? You'll see every once in a blue moon, you'll see someone that has a lip that isn't quite well developed, and your palate, cleft palate, is here in your mouth. That's probably if you were ever running with something in your mouth, like a straw, a parent would have yelled at you to stop. You're going to run it through the roof of your mouth. And the reason that's bad is that connects to your sinus passages. And so it can lead to speech issues. It causes issues with eating and swallowing, sinus infections. it's very correctable now. We're so lucky. It's very correctable now. And there's other reasons that you can end up with cleft palate and lip issues. Impaired heart rate, again, blood vessel abnormalities, infant death, asthma, and cancer later in childhood even. As babies, the effect of having had a mother who smoked or was exposed to smoke would be less attentive to sounds, more muscle tension, more excitable when touched and visually stimulated, often more colicky. As children, you have shorter attention spans, difficulties with impulsivity and overactivity, poorer memories, lower intelligence and achievement test scores, and higher levels of disruptive aggressive behavior. Question is why? Nicotine. It's the nicotine in it. So nicotine, again, just like those drugs, constricts the blood vessels, decreasing the flow of oxygen to the developing brain and the entire fetus. It causes the placenta to grow abnormally. And it reduces nutrients, which is the same thing it does in a person when they smoke. It raises carbon monoxide displacing oxygen. It damages the nervous system, and it slows fetal body growth. So my question is vaping. Our textbook is old enough. They do not address vaping. And our textbook isn't even old by any means. It was published, I think, in 2019. So one of your homework assignments at the end of this week and into next week that you'll have plenty of time is you all are going to pick a teratogen to research and do like a simple slideshow on it. And when you, or an infographic, you get to choose. And when I want someone, and I'll help try and remember to do this, but tuck this away. I want at least one of you to research vaping, because vaping is quite popular. And we have this idea that it doesn't hurt us. I'm crying fake news, but I want someone to do the research and see if Beth is right or not. And the research is going to be fairly inconclusive because it's new enough. Smoking's been around long enough that we know for a fact the harm that it does to our body. And so, and to our children and our developing child, even when they're in our womb. So I want someone to do the vaping research. So alcohol, tobacco, drugs, legal and illegal, and now alcohol. There's three main syndromes here. You have fetal alcohol syndrome, partial fetal alcohol syndrome, and alcohol-related neurodevelopmental disorder. Key takeaways I want you to take here, not word for word, is they all impact growth to the point of there are certain facial features that you can see in children who have fetal alcohol syndrome sometimes. And all of these are sometimes, it's not always and always. It'll slow your physical growth. You'll have some facial abnormalities sometimes. And because, again, alcohol decreases your oxygen to the brain, you will have some brain injuries, which means limited functioning of some executive skills. Again, these all come down to impulsivity control, cognitive issues, which is your IQ and your intelligence tests. Motor skills can be impaired. So everything that it can do to the adult when it's given the extreme, it can do to the developing fetus. And I will tell you, this one is actually really hard to diagnose. There are certain characteristics, like those listed here, that doctors can see, and they will try to, piece together. But because it's somewhat inconclusive, and it's you rely a lot on honesty from that biological mom, it's a hard one to diagnose. We have friends actually that they've adopted 4 children, and one of them has been diagnosed with fetal alcohol syndrome, and it's so severe he will never be able to fully be independent. His cognitive issues have been so impaired, but there's no other biological or neurological reason. He was a child adopted out of foster care, and it's really very sad what was happened. But again, to environment, it's really amazing what his foster parents are able to do with him and for him, and he's living a great life. And they have a functioning kind of urban farm, and he does really well, and that's what he wants to do as a career. So it's something, it's sad, but because of the environmental, there's a lot that can happen in the positive. All right, other things. So let's move on. Other maternal factors. Radiation. Because of Hiroshima and what we learned when we dropped a nuclear bomb on people, we were able to understand the effects of radiation on children and women who were pregnant. Now, go back to ethical research from Module 1. Would it be ethical for us to have an experiment where we exposed some pregnant women to radiation and others we didn't? No, that would be horrible. But because of a horrific event, we were able to take away some scientific understanding. When you go to the hospital or you have to have an x-ray, they put lead gowns on you. They ask you if you might be pregnant, if there's any chance of that. Those are important times to be honest because we know of what that can do. So radiation, x-rays, environmental pollutions. So go back to that dose. Dose is about how much. So if you live in a city setting that is highly polluted, where there aren't lots of regulations on air quality, that would have an effect on the developing fetus over time. And we know that from studying different communities in different countries. Infectious diseases. There's a lot being said right now even about when a woman should get her COVID vaccination versus not, and the impacts of COVID on a developing fetus. Will that baby necessarily have COVID? And they're finding that every time the baby doesn't have COVID if they're born when the mom is positive. But they know that the newborn can get COVID from the mother. So they separate them immediately until they're both tested conclusively. So infectious diseases can definitely impact that developing fetus. Other maternal factors, nutrition. How well is the mother's nutrition? When you're pregnant, one of the first things they'll have you start taking is folic acid because it helps that developing neurological system of that baby. And we know that. We know that that is something that most women are short of when they are expecting. Emotional stress. Our textbook goes into great detail on how emotional stress has shown to impact the development of a child. So I want you to think back to some of those impacts of nicotine. They talked about how the baby was kind of more tense. That wasn't the word they used, but essentially the baby was rigid. It was more tense. It had a shrill cry, when they're exposed to drugs. Think about if you're a person who's prone to abusing something or you have an addiction, you probably are not good at managing stress. If you're not good at managing stress and you're taking that in, again, you're decreasing oxygen to not just yourself, but to your developing fetus over time, carrying that stress. What's one of our stress management strategies? I'm sure you've all been taught. If you get upset, what should you do first?
Breathe. Take a deep breath.
Yeah, exactly, right? Because when you laugh really hard, think of you're taking in a lot more oxygen and your brain feels better, right? Yeah, if we were all billionaires and we started to feel a little crummy, we'd go to an oxygen bar and have some fancy oxygen to feel better, right? Because we know your body feels better when you have more oxygen. So it's logical. It's just amazing that we can impact something so tiny, and these little things can impact that baby. But remember, it's not just a stressful event. It's the dose. Again, that long-term ability to manage stress. Every expecting mother feels stress at some point during her pregnancy, and it doesn't mean her baby is going to not develop right. It's about that dosage, that longevity of it all. RH factor incompatibility is a specific issue that we now know and we now test for, and it has to do with what blood type you are and what blood type your baby is. And there's a certain combination that if the mother is of a certain blood type and the baby is, if they cross during birth, it can be a problem. But because we know about it now, they test at the right before you have your baby, and it's really not a big deal. And then we talked about maternal age, how the older you are, the more likely you are to carry on certain chromosomal disorders, as well as have some environmental concerns. But again, the key too with all of this is prenatal care. 6% of women in the US wait until after their first trimester or never receive any prenatal care. And there's 3 reasons why this happens. One is financial hardship. You guys in Kansas probably have heard of Medicare expansion, and in Kansas we do not have this, which means we have quite a few adults walking around who do not have health insurance. One of the major groups of people without health insurance are single mothers, and that's because a lot of times they will make too much to qualify for Medicare, but their employers do not provide health insurance. Unfortunately, childcare is a perfect example of this, as well as certain CNAs and CMAs, so nursing assistants and Medicaid assistants in nursing homes. A lot of times those facilities, they don't offer the health insurance programs, and so you can run into issues there. So if they have children, their children qualify for the state health insurance for children, but they as adults do not. And so if they don't and they get pregnant, they might just assume, I can't get health care. Now we know that often that's not the case, that they can qualify for another government program at that point. There's also situational barriers. Sometimes it's where you live, and is there a clinic? You know, Nickerson's a good example. You guys might not have a health clinic there right in Nickerson. There may be one in Hutch. But that's challenging, right? If you don't have a car, and gas isn't always the cheapest. So getting to that doctor, it can be situational. And sometimes it's personal. Perhaps you've had a situation where you felt misled by doctors, where there was an unfortunate health outcome in your family with a physician involved. And so there may be trust issues. Sometimes it can be religious beliefs. Sometimes it can be, I had an oopsies and I don't want to admit it. And if I go to the doctor, I'm having to admit it. And so there can be other reasons why women don't get that prenatal care. But we know that with quality prenatal care, all of those other issues we talked about can be greatly reduced because it's a form of support. You have someone to talk to coach you.